Hello friends, good evening. Welcome to FARRE series, Injuries. This is Dr. Manjunath, your FMT guru. We are going to discuss some important questions, long essays, short answers from the chapter Traumatology, the mechanical injuries. Am I audible and visible, guys? Am I audible? Good evening. Rohit Meena. Editing Gazettes. Good evening. Hey, Rajat, are you there, Rajat? Am I audible? Am I audible? Visible? Say yes or no. See, injuries, very important chapter. The question can be asked about mechanical injuries. Injuries caused by blunt force, sharp force. Thermal injuries. Injuries caused by dry burn or moist heat. Or sometimes question can be asked about blast injuries. Primary, secondary, tertiary, quaternary, quinary and all. Very important topic, difference between entry wound, exit wound from forensic ballistic. And very important topic, must know topic, grievous hurt 116 BNS. You must know this topic to pass your final FMT practicals. Yes, I'm audible and visible. Audible and visible. Okay. Okay, Diksha, don't worry. Be confident. Attend all the lectures of FARRE. Go through all these topics. You are going to pass. Okay. Forensic is not that difficult subject. You can manage. All good, all good. Chalo. In the beginning, as a part of Booth Bungalow series, see, during crime scene visit, this is the appearance of the dead person. Around 55-year-old male, chronic alcoholic, found dead in a gutter. So he was found dead in a gutter, wearing, orange clothes. You can also see here, there, some plastic covers, paper is there. And further examination, during post-mortem examination, clearly visible froth inside the trachea. So this is trachea, a right bronchus and a left bronchus. Inside that, clearly visible froth is there, copious froth. On further examination, the face is congested. The front of the chest, that shows the postmortem hypostasis. During examination of lungs are congested, and FSL, that shows blood alcohol level is around 150 milligram percentage, 150 to 200 milligram percentage by using gas chromatography. My question is, look at these images. Find out what is the cause of death. So this is the image number 1, image number 2, image number 3, image number 4, and image number 5 that shows alcohol. Yes, guys. Try. What is this condition? Rakesh, Rajat, Fahim, Rajesh, गोपसा महेचा. What is this? बताओ, जल्दी बताओ, ये क्या है आंसर? सो क्राइम सीन में क्या फाइंडिंग है? ए अपीयरेंस है, ट्रेकिया में क्या है? फ्रोथ है, फेस में क्या फाइंडिंग है? कंजेस्टेड फेस है, पोस्टमार्टम हाइपोस्टैसिस है, लंग्स में क्या है? कंजेशन है, और ब्लड में क्या है? ब्लड अल्कोहल लेवल इज अराउंड 200 मिलीग्राम परसेंटेज. क्रॉनिक अल्कोहलिक है. सो क्या हो सकता है? So editing Gazette is telling sir positional asphyxia. Some students are telling sir shallow water drowning. Okay, yes. So the cause of death here, it is a combination of positional asphyxia along with shallow water drowning. Why? Because the froth is there. The froth inside the trachea that shows some foreign particle inside the tract. And asphyxial signs are there. Cyanosis, congestion, petechial hemorrhages. It go in favor of asphyxia. Positional asphyxia under the influence of alcohol along with shallow water drowning. So this is one interesting case of forensic medicine, the postmortem, autopsy examination. Good, many answered correctly. That's great. So with this introduction, let's start. Okay, one more picture is there. One more crime scene photo. So now I am in the Shaw Pariksha room. I am forensic expert. A case of unnatural death. The body was taken into postmortem room. So we are just entering postmortem room. During external examination, what you can see here, some brown color nodules. Brown nodules are there, and it is present over the face, present over the abdomen, also over the hands. The history of electrocution, history of high voltage electrocution present. No injuries on the body, no abrasion, no bruise, no laceration, no suspicion. It's a clear-cut case of electrocution. My question, what is this condition and what is this known as? Come on guys. So this is classical case of high voltage burn known as crocodile burn. Crocodile burn caused by electrocution of voltage more than 1000. Yes, so with this introduction, let's start injuries. I said in the beginning, there are some important questions like example, mechanical injuries, 5 marks question. Thermal injuries, 10 marks question. Dry burn injury, autopsy finding, 10 marks. Scald injury, 5 mark. Entry wound, exit wound, favorite question. Blast injuries, grievous hurt. Medico-legal aspects of the wounds. Hurt, what is injury, what is hurt, what is wound, what is simple hurt, what is grievous hurt, types of abrasion, types of bruise, color changes bruise, artificial bruise. There are n number of questions that can be framed from injuries. Yes, good. Monisha, very good. And Baishaki, Rakesh Malanawar, excellent answer. This is the case of crocodile burn. Chalo. The first topic of the day, describe grievous hurt. Commonly asked in practicals. Almost in any exam, any forensic exam, FMT exam, any examiner going to ask one question, explain grievous hurt. I am going to pass you. Otherwise, I am going to fail you. So this is basic of forensic medicine, grievous hurt. याद रखना ग्रीवियस मतलब नॉन सिंपल है. नॉन सिंपल मतलब गंभीर है, किसी को गंभीर चोट पहुंचाना. 116 BNS है, याद रखना पड़ेगा. 116 क्या है? गंभीर चोट मतलब ग्रीवस हार्ट है. 114 क्या है? सिंपल चोट है, माइनर चोट है, 1 साल की सजा होगी. ग्रीवस हर्ट में 7 साल की सजा होगी. So grievous hurt, very important question. Write this in chat box. 116 BNS is equal to 320 IPC. लिखो. चैट बॉक्स में लिखो गाइस. Yes, 116. Good evening, Kiran. Good evening, all. Great. There are 8 clauses are there. How many clauses? 8 clauses. What are they? The first one, emasculation. Second one, permanent loss of privation of sight of either eye. Third one, permanent privation of sight or hearing of either ear. Privation of member or joint. Like that, there are 8 clauses are there. You need to write like this. Emasculation, that is loss of muscle and vigor, leading to impotency, limited to males only. Permanent privation of sight of either eye. Privation matlab loss. Second clause. 2 eyes. Second clause. Emasculation, that is applicable to male. 1 emasculation. 2 or second one, that is the eye. Third, permanent privation of hearing of either ear. याद रखना परमानेंट होना चाहिए, टेम्पररी नहीं, परमानेंट होना चाहिए. प्रिवेशन मतलब लॉस. Hearing of either ear. It can be complete or it can be incomplete loss, but it must be permanent. चौथा है privation of any member or joint. Like thumb है ना, thumb member है, joint है, member है. So loss of member or joint can be 4th clause of grievous hurt. What is member? Member is a part of the body which has a specific function, which has a function actually. Thumb is a member, upper limb is a member, lower limb is a member, ear is a member, nose is a member, even tooth is also a member of the body. So that is the 4th one. So just remember, 4th is member. लिखो 4th क्या है? member है. member. लिखो all of everyone. किरण, राजेश, आकाश, प्रेम कोलकर. Keep writing, keep writing. 4th member. First one, emasculation. Second one, 2 eyes are there, that is eye. Third one, inner ear, outer ear, middle ear. Third one is ear. 4th is member. Okay? This can be viva question. What is member? Give me an example for member. Member मतलब hand है, पैर है ना, कान होगा, नाक होगा, anything that is. 4th member, बहुत बढ़िया. ठीक है, good answer. Akash. Now look at this. I said already, all these are example for grievous hurt. ठीक है ना? So 1, 2, 3, 4. So what is the finding here? Perforation है. Perforation. Here क्या है? Castration. Castration or damage to the genital organ in males can lead to inability to conduct sexual intercourse. When person is unable to do sexual intercourse, impotency due to emasculation can be grievous hurt. 7 साल की सजा होगी offender के लिए. और injury to the eye, gouging out of eye, damage to the eye, damage to the cornea. So grievous hurt. You can see here this picture. So amputation of thumb is a member. Yes, hope आकाश प्रेम कोकर समझ में आ रहा है ना आपको? हाँ, ठीक है, बहुत बढ़िया, हो गया. हाफ कहानी इज ओवर नाउ. नाउ सेकेंड पार्ट ऑफ द कहानी. सेकेंड पार्ट में क्या है? डिस्ट्रक्शन और परमानेंट इंपेयरिंग ऑफ पावर्स ऑफ एनी मेंबर और जॉइंट. पावर, दिस इज पावर. पावर स्टार पुनीत राजकुमार है ना. 5th इज पावर, पावर स्टार. याद रखना पड़ेगा. लिखो ऑल ऑफ यू. 5th is equal to power, power star. Loss of power. See, joint, loss of joint power. or paralysis of the muscles. Like example, paralysis of the limb due to burn contracture, wrist drop, foot drop, burn contracture leading to inability to move the limb. So all these are example for the fifth one, that is the power star. Good, बहुत बढ़िया. Sixth one याद रखना पड़ेगा, face है ना, permanent disfiguration of head or face. Head, face, neck नहीं, इसमें क्या है, head और face है, याद रखना पड़ेगा. 124 नाउ अलग ही सेक्शन है, इसमें आता है विट्रियोलेज, एसिड अटैक. तो वाइवा में पूछ सकते हैं 124 क्या होता है. 124 है विट्रियोलेज. सिक्स्थ वन है परमानेंट डिस्फिगरेशन ऑफ हेड और फेस. लाइक एग्जांपल, अब्रेशन ओवर द फेस, एंड फीमेल, शी इज अ सेलिब्रिटी, so it can be grievous hurt. Abrasion over a face, but abrasion never causes scar formation. It again depends on the condition, depends on the person. So permanent disfiguration of head or face leading to scar formation can be grievous hurt. Then fracture, dislocation of bone or tooth. It can be linear fracture, compound fracture, complete fracture, incomplete fracture. Any fracture, grievous hurt. Dislocation of tooth. So mere dislocation of the tooth because of old age is not grievous hurt. The dislocation and loosening of the tooth that occurs in the old age, that is not grievous hurt. So dislocation as a result of trauma is grievous hurt. This is seventh one. सेवेंथ क्या है, टूथ है, याद रखना पड़ेगा. सेवेंथ क्या है, फ्रैक्चर है. लिखो ऑल ऑफ यू, सेवेंथ इज फ्रैक्चर. फिफ्थ वन पावर स्टार. सिक्स्थ वन इज फेस, सिक्स्थ सेंस. सेवेंथ वन पावर, दैट इज फ्रैक्चर. एट्थ वन बहुत बढ़िया. एट्थ में लिखना है any hurt which endangers life. मतलब क्या है, हेड इंजुरी है, endangers life है. stab injury over the abdomen endangers life. Squeezing of testicle can endanger life. It can lead to vasovagal inhibition and death. So it again depends on the condition. Stab injury endangers life. Head injury endangers life. So in general they are known as dangerous injury. Okay, yes. Or which causes sufferer to be during space of 15 days. 15 days severe bodily pain. severe pain है, मतलब severe दर्द है, मतलब 9 out of 10 पेन है. ठीक है. And unable to follow his ordinary pursuit. This is very important viva question. What do you mean by ordinary pursuit? Can you give example? Ordinary pursuit मतलब क्या है? Give examples. Like example, FMT guru taking class. Is it ordinary pursuit? See, FMT guru is there. So because of some hurt, because of some grievous hurt, I am unable to take my class. Is it grievous hurt or simple hurt? Yes guys, बहुत बढ़िया. Yes guys, come on. See, I am going to admit today to some government hospital. I am, I'll give some complaint. So I'm unable to take class, forensic medicine class, FMT class for next 15 days. Is it a grievous hurt or simple hurt? बहुत बढ़िया, come on. हाँ, याद रखना पड़ेगा guys. The ordinary pursuit means not official work. Ordinary work is not equal to official work. Ordinary means completely ordinary. What are ordinary activities? Brushing teeth, wearing shirt, walking, going to toilet. All these are ordinary pursuit. Simply taking 15 days leave and admission in some hospital. Can it be grievous hurt? No, it is not grievous hurt. It is simple hurt, or it is not hurt at all. याद रखना पड़ेगा ये सब है ना, बहुत ही जरूरी है. बार बार पूछते एग्जाम में, आपको पढ़ना ही पड़ेगा. समझ में आ रहा है ना आपको? सिंपल हर्ट. अच्छा, ग्रीवस फॉर अस इफ यू डोंट टेक क्लास. ओके, ओ बहुत बढ़िया यार, चलो यार बहुत बढ़िया है ना. गुड गुड. हु इज दैट? क्लैश. क्लैश बेटा, आई एम वेरी हैप्पी. बेटा ये क्या है बताओ? ये है वाटरमेलन है. कैन एनीवन टेल मी विच इज नोन एज वाटरमेलन पॉइजन? इंटरेस्टिंग क्वेश्चन. नाउ सडनली आई गॉट सम आइडिया. Yes guys, come on. Recently happened in Mumbai. A family of 5 found dead after taking watermelon. Watermelon. My question, what was the poison used in that case leading to death? Yes, yes. Come on guys, come on. पॉइजन कौन सा पॉइजन है? फूड पॉइजन? नहीं नहीं, वो फूड नहीं है, वो है अल्यूमिनियम फॉस्फाइड. सो अल्यूमिनियम फॉस्फाइड विच वाज स्प्रेड ओवर द वाटरमेलन, है ना, आपको दिख रहा है ना, ये वाटरमेलन है. अल्यूमिनियम फॉस्फाइड वाज स्प्रेड लीडिंग टू सडन डेथ. अल्यूमिनियम फॉस्फाइड है ना, वेरी वेरी टॉक्सिक है. इवन 500 milligram कैन लीड टू डेथ. आफ्टर द क्लास यू कैन टाइप biryani death in Mumbai, you will come to know. Okay, zinc phosphide, aluminum phosphide, याद रखना पड़ेगा. बहुत बढ़िया. चलो हो गया. Yes, now you tell me clauses. What are the clauses here? What is the clause here? What is here? 1 क्या clause है? Here इसमें क्या clause है? इसमें क्या clause है? इसमें क्या है? बताओ जल्दी बताओ. बताओ क्या है? 1 में क्या है? बर्न कॉन्ट्रैक्चर है लीडिंग टू लॉस ऑफ पावर. 2 में क्या है? परमानेंट डिसफिगरेशन ऑफ फेस है. 3 में है फ्रैक्चर है. 4th में है टॉयलेट. पेशेंट इज अनेबल टू गो टू टॉयलेट बिकॉज ऑफ द हर्ट. सो व्हाट आर दीज एक्चुअली? विच क्लॉज बताओ क्या है? जल्दी बताओ, तो टाइम नहीं है मेरे पास. फास्ट मैन, फास्ट. 5th क्लॉज. ओके, फर्स्ट वन क्या है? फर्स्ट इज बेसिकली 5th क्लॉज है. 5th क्लॉज. सेकेंड वन 6th क्लॉज. दिस इज 7th क्लॉज. दिस इज 8th क्लॉज. बहुत बढ़िया, एक्सलेंट आंसर. ठीक है ठीक है ठीक है ठीक है ठीक है, बहुत बढ़िया. हाँ, नाउ आ गया ना, बहुत बढ़िया. ये देखो, जो डर गया समझो मर गया. जो डर गया समझो मर गया. आपको पता होगा, ही इज गब्बर सिंह एंड अमिताभ बच्चन. आई हैव ए स्टोरी फॉर यू टुडे. One very very nice story. Can you try? Very interesting story. See, Amitabh Bachchan, and I don't know the name in that movie, Amitabh and Gabbar Singh, they are not friends, they are actually enemies. So now look at this. Gabbar Singh causes scratch abrasion over Amitabh's cornea. So little funny guys, little funny. Okay, leading to permanent scar, results in partial vision loss. Gabbar Singh, scratch abrasion, Amitabh's cornea, permanent scar resulting to partial vision loss. Gabbar Singh offered corneal transplantation. कोई टेंशन मत लेना, don't worry, I'll give you 50,000. You go to some hospital and you just undergo some surgery. Amitabh now is able to see very clearly. Now Amitabh is very fine. True about above scenario. Gabbar Singh is not guilty as he agreed to pay expense of corneal transplantation. Gabbar Singh is not guilty as vision loss is temporary partial. Gabbar Singh is guilty of hurt. Gabbar Singh is guilty of grievous hurt as per 116 BNS. बताओ Gabbar Singh. Rajesh and others. Hope you are enjoying class today. Yes, good. Gabbar Singh is guilty of grievous hurt as per 116 BNS. बहुत बढ़िया, excellent answer. Excellent. Remember, what matters here is the natural course. If natural course leading to permanent loss, grievous hurt. Nothing to do with the surgical intervention. Surgical intervention is not applicable in grievous hurt. What matters here? Natural course. So corneal abrasion is there, can lead to grievous hurt only. It can't be simple hurt. Like tympanic perforation, grievous hurt only. It can be corrected. Nothing to do with the surgical intervention. Curable, incurable, doesn't matter. Hope you understood, guys. ठीक है, बहुत बढ़िया. So डरना नहीं है forensic. डरना नहीं है. Forensic is very easy. I'm there with you, don't worry. So all of you guys have understood grievous hurt. Grievous hurt, गंभीर चोट. क्या समझ में आ गया? बताओ, कोई डाउट है? बताओ, हम डिस्कस करेंगे अभी. Yes, come on guys. Grievous hurt is done. Finally, grievous hurt is done. Simple hurt याद रखना 124. हाँ, सिंपल हर्ट 114 है, ग्रीवस हर्ट 116 है. बस कहानी खत्म. यस किरण, रजत, डर के आगे जीत है. ओके, क्लैश जोन इज टेलिंग सर डर के आगे जीत है. यस, बहुत बढ़िया. ओके, चल. हाँ, नेक्स्ट टॉपिक है classify mechanical injuries, define abrasion and its types, medico-legal importance. Very important topic, guys. Abrasion 5 marks question, bruise 5 marks question, laceration 5 marks, stab wound 3 marks, cutthroat injury 10 mark. Then stab injury, defense injury, active and passive defense injury. Commonly asked, classify mechanical injuries. Classification: caused by blunt force trauma, caused by sharp force trauma, or caused by the firearm injury. So broadly classified into 3. Okay, blunt force injuries, इसमें क्या है? Abrasion, contusion, laceration, fractures. Sharp force injury इसमें आता है incised wound, chop wound and the stab injury. Firearm injury इसमें आता है firearm wounds, blast injuries. So this is broad classification. Now abrasion again of 4 types, 3 marks question. What are 4 types of abrasion? Scratch abrasion, graze abrasion, pressure abrasion, imprint abrasion. 3 marks question. Scratch abrasion, like example in case of rape, multiple scratch abrasion over the thighs, over the breast, suggestive of some injury, forcible sexual intercourse. Hanging, ligature mark, pressure abrasion. So abrasion can be of 4 types. 3 marks question. Contusion, what are types of contusion? 3 marks. Contusion can be superficial bruise, deep bruise, railway track bruise. ओके, सुपरफिशियल हो गया, डीप हो गया, रेलवे. इसके बाद स्पेक्टेकल हेमोटोमा, बैटल साइन, 6 penny bruise, 6 penny. Again, color changes, very commonly asked. Color changes, remember RBBGY. After the class, go through color changes in case of bruise. Red color, blue color, brown color, black color, green color, yellow color. RBBGY, 3 marks question. All of you write in the chat box. Bruise is equal to RBBGY. लिखो, बहुत बढ़िया, लिखो लिखो गाइस. धनुष, धनुष, धनुष बेटा, वेरी गुड. धनुष, excellent. So laceration 4 types: split laceration, stretch laceration, avulsion laceration, tear laceration. The laceration has irregular margin, 3 marks question. Fractures, very commonly asked, 5 marks question. So after the class, go through types of fracture: linear fracture, depressed fracture, hinge fracture, ring fracture, pond fracture, perforating fracture. Very important 5 marks question. Incised wound, incised wound types. Basically a cutthroat injury. Suicidal cutthroat, homicidal cutthroat. 10 marks question. Chop wound, deep gaping wounds, 3 marks question. Stab injury, depth is maximum, 3 marks. Then firearm injuries basically entry wound, exit wound. याद रखना पड़ेगा. ओके, गुड, बहुत बढ़िया. चलो आगे देखते हैं. Now look at this. Now you are in the शव परीक्षा room. So FMT Guru is there in the शव परीक्षा room for the autopsy. Autopsy means necropsy. Necropsy means thanatopsy, means post-mortem examination. So during post-mortem examination, there is a finding on the back of the body, a case of road traffic accident. What is this abrasion known as? Road traffic accident. Sad story. So many people are dying due to road traffic accident. This is one story. So you are a forensic expert. You need to give opinion. What type of injury is this? Is it pressure abrasion, imprint abrasion, scratch abrasion, graze abrasion? Anyone? हाँ, बहुत बढ़िया. ये है graze abrasion है. Graze. Graze मतलब brush burn, also known as friction burn. Most common mechanical injury, graze abrasion. Okay, most common. In general, scratch abrasion, but in road traffic accident, graze abrasion. By looking at the graze, you can identify direction also. Now look at this graze abrasion. You tell me direction. What is the direction in this case? Is it from left to right or right to left? Can anyone tell me? Now you are expert. You are expert now. You are forensic expert. बहुत बढ़िया. Yes, come on guys, come on. Now say example, this is right side, this is left side. My question is, what is your inference? Look at this. This is denuded epithelium here. Denuded epithelium. Denuded epithelium. Okay, very good. It is right to left. Kiran is answering, sir, center to periphery, right to left. Good answer. ओके चलो आगे आगे देखते हैं. हाँ, नाउ वेरी इंटरेस्टिंग क्वेश्चन. A case of assault. A case of assault. You can see here human bite. Human bite is there. So right and left quadrant, upper quadrant, lower quadrant. Human bite is example for what type of abrasion is this? It can be bruise also. If it enters only epidermis, abrasion. If it enters dermis, if it leads to scar formation, then it can be bruise also. My question is, here imprint is seen. Imprint of the weapon is seen over the injury. What type of abrasion is this? Is it pattern abrasion or imprint abrasion? I have very good question now. Is it pattern abrasion or imprint abrasion? ये क्या है? पैटर्न अब्रेशन है और इम्प्रिंट अब्रेशन है. हाँ हाँ बहुत बढ़िया. राइट टू लेफ्ट बहुत बढ़िया. ठीक है. सो दिस इज बेसिकली पैटर्न अब्रेशन है. पैटर्न याद रखना पड़ेगा. याद रखो पैटर्न इज ऑफ टू टाइप्स, इम्प्रिंट and pressure. So pattern is a broad term. It includes imprint and pressure both. Viva question. So can be pattern bruise, pattern abrasion, sometimes pattern fracture also. Pattern fracture means depressed fracture, signature fracture. Okay, yes. राजेश टुडेज क्लास फुल अटेंडेंस. ओके बहुत बढ़िया यार, बहुत बढ़िया. मैंने तो प्रेजर बोला था. अनिल केरले, डोंट वरी. प्रेजर अब्रेशन है ना, हैंगिंग. प्रेजर प्रेजर प्रेजर, डिप्रेशन डिप्रेशन डिप्रेशन. ओके अंडरस्टूड आई थिंक. डोंट वरी. सो डोंट टेक प्रेजर, डोंट टेक डिप्रेशन, नो प्रॉब्लम. बहुत बढ़िया. नाउ लुक एट दिस नाउ. ओके suddenly in between some picture has come. So now look at this. Oh, my question is, what is this firearm? What is this firearm? Firearm hai na, firearm. Have you seen this movie, KGF movie? Dodapha, Dodama hai na. What is this firearm? Come on guys, you are excellent, you are best. You tell me what is this firearm. If you tell me, you will get 3D chocolate from me. 3D chocolate from me. Much love from Karwar Crims. Rajesh, excellent यार, बहुत बढ़िया, excellent. हाँ हाँ, very good, many answered. Sir, ये shotgun है. Excellent. Shotgun. What is the ammunition? Ammunition is shotgun cartridge. Shotgun cartridge. So this is shotgun cartridge. What is the range of the shotgun? 30 to 40 meters. 30 to 40 meters. Okay. It is a smooth bore weapon. Smooth bore weapon means no lands, no grooves. No lands and no grooves. मतलब smooth. स्मूथ मतलब क्या है? मतलब लैंड्स नहीं है, ग्रूस भी नहीं है, स्मूथ है. शॉर्ट गन नहीं है बेटा, शॉर्ट गन है. शॉर्ट SHOT गाइस, SHOT short. So this is shotgun weapon. The question can be asked, classify firearms. Your answer must be rifle firearm, shotgun firearm, smoothbore firearm. Smoothbore is shotgun, rifle matlab AK-47, revolver, pistol or rifled. Only shotgun is basically smoothbore. Smoothbore matlab no lands and grooves. Okay, so circular cylinder like a barrel. Okay, fine. Again question asked, what is the structure of shotgun cartridge? Anyone? What is the structure of shotgun cartridge? Look at this. This is a shotgun cartridge. Can anyone label it? I'm going to write. You need to label. I'm going to write. See, this is the shotgun cartridge. What is the structure one? and here is structure 2, and here is structure 3, and here is structure 4. Now anyone, can you label shotgun cartridge from 1, 2, 3, 4? So there are 4 compartments are there. Compartment 1, what is present? Compartment 2, what is that present? Compartment 3, what is that present? And 4. Come on guys, come on. You need to answer my question. So keep answering, keep answering. What is that? See, 1 is basically shotgun pellets. 2 is basically wad. 3 is gunpowder. The 4 is primer. So कहानी बहुत सिंपल है. कहानी क्या है? पेलेट्स है, वैड है, गन पाउडर है, प्राइमर है. बस हो गया कहानी. 3 मार्क्स क्वेश्चन. 3 मार्क्स क्वेश्चन यार. पेलेट्स, वैड, गन पाउडर, प्राइमर. डन. ठीक है, समझ में आ रहा है ना आपको? यस, प्राइमर. 4 प्राइमर. वेरी गुड. प्रेम कोलकर, अनिल, फाइजान अलीवानी, all guys, and great. Now this is okay. Okay, now question is difference between entry wound and exit wound. So Adira, you must be knowing very famous movie KGF, Adira movie. So question is not about Sanjay Dutt, not about Adira. The question is about difference between entry wound and exit wound. Favorite of examiner. Favorite of examiner. Come on guys, anyone tell me what is the feature of entry wound? What are the features of entry wound? Now let me discuss here. This is entry wound. Tell me what are the features of entry wound? I am going to help you, don't worry, I am there. But you try, then I am going to help you. Adira, entry wound is small inverted. Kiran is telling sir entry wound is small. Very good. Entry wound is small, inverted. Small and inverted. बहुत बढ़िया. Entry small inverted. हो गया. Now दूसरा पॉइंट आपको बताना पड़ेगा. अच्छा, एग्जिट वुंड इज लार्ज इन्वर्टेड. बहुत बढ़िया. ये देखो इन्वर्टेड मार्जिन है ना. सो यू कैन सी द इन्वर्टेड मार्जिन. दिस इज द एंट्री वुंड. इन्वर्टेड मार्जिन. You can see here blackening also. So blackening is a feature of entry wound. It is always absent in exit wound. Blackening due to soothe particles. If blackening is there, close shot. Blackening is there, close shot. Okay, blackening is a feature. Then you can also see abrasion collar. Because of the spinning movement of the bullet. Abrasion collar is always absent in exit wound. Okay. Then grease collar. So grease because of the dust particles, because of the grease, entry wound. Tattooing is a feature of entry wound. Very good. You can also see tattooing because of gunpowder. That is not there in this picture. Only blackening you can see, grease collar, abrasion collar. Tattooing present in near shot, intermediate shot, near shot. Sometime in entry wound you will see singeing of hair also. You can see the singeing here. Okay. We can make some 5-6 differences here only. Small है, inverted है, blackening present है, abrasion collar है, grease collar है, tattooing है और singeing भी है. तो entry wound है. Exit wound में क्या है? Large, everted, abrasion collar absent, grease collar absent, blackening, tattooing absent. Everything is absent in exit wound. Okay, hope you are getting my point. Hope you are getting my point. ठीक है. Now look at this. One more picture is there. Anil, you don't worry, Anil. So I am just asking you, Anil Kerale, which is entry wound, which is exit wound. Look at this now. Now this is crime scene photo. You are in postmortem room now. So skeletal remains are there. So what is this wound A, and what is this A and B? This is A and this is B. My question, which is entry wound, which is exit wound? Which is entry wound, which is exit wound? While looking at the image, can you tell me? Come on guys. See here, you can see this picture. I think this picture we can make out here. This picture. Outer table beveling is there. When you see outer table beveling, exit wound. Outer table is more damaged. If inner table beveling is there, inner table is more damaged, entry wound. So in simple word, in this image, it is basically entry wound. This is entry gunshot wound. Why? Because inner table beveling is there. Inner table beveling. And here outer table beveling is there. So this is exit wound. Exit wound. ठीक है? So my question now, can it be suicidal wound? Can it be suicidal like this? Is it possible like this? Entry wound over the frontal bone and exit wound over the occipital bone. Can it be suicidal wound? Or it can be, close range, point blank range? Yes, it can be. It can be any shot, but it can be suicidal also, like this. Yes. Okay, okay. Chalo. I hope you understood. This is okay. This table after the class, go through. Yes, guys, go through this table. This is taken from KSN Reddy. KSN Reddy textbook. Go through this table. 5 marks question. 5 mark. We discussed many things here. Here, there we discussed difference between entry wound and exit wound. हो गया. Yes, बहुत बढ़िया guys. बहुत बढ़िया. Many are answering. I'm happy today. I'm very, very happy today. I am very happy. So now I am very happy. So Kiran Prem Kulkar, for you now there is a song for you. Do you want to listen a song, Kannada song now? If you want, I can try today. I can try some new song today. Okay. Are you there, guys? Are you there? Just to keep you awake. Okay. Anil Kerale. Akash. Try Akash. All are answering. That's great. Okay. Shall I start? ಗೊಂಬೆ ಹೇಳುತ್ತೈತೆ, ಗೊಂಬೆ ಹೇಳುತ್ತೈತೆ, ಮತ್ತೆ ಹೇಳುತ್ತೈತೆ ನೀನೇ ರಾಜಕುಮಾರ, ನೀನೇ ರಾಜಕುಮಾರ, ಹೊಸ ಬೆಳಕೊಂದು. That's all. Let's continue tomorrow again. Okay? Chalo guys. Okay. Let's start. Now next question. Next question guys, it's a coffee time now. Coffee. Cold coffee, hot coffee. Remember a hot coffee, that is basically scald injury. So what is this injury? Scald injury. Scald matlab kya hai? Scald matlab moist burn. Okay. Okay. चलो यार झगड़ा मत करो यार, don't quarrel in my class यार please. You are a good boy, I know you are a good boy. ठीक है, चलो. So classify thermal injuries and explain rule of 9. 5 marks question. See, now there are two images are there. In both the images you need to identify these injuries. Here is injury, here is the thermal injury, generalized hyperthermia. Here is generalized hyperthermia. Generalized hyperthermia. Here is generalized hypothermia. Can anyone tell me what are the conditions caused by generalized hypothermia? Caused by fever. What are the general conditions caused by high temperature? What are the general conditions caused by low temperature? Remember, generalized hyperthermia leads to 3 conditions. One is heat stroke. In heat stroke, sweating is absent. MCQ. Heat stroke, postmortem caloricity is seen. 2 important MCQ. Heat stroke, sweating is absent. Heat stroke, postmortem caloricity can be seen. हो गया. Second, heat syncope. Heat syncope. हो गया. And heat fatigue. That what is that known as? Heat fatigue. So 3 conditions very common. ठीक है. Generalized hypothermia, remember there are 2 conditions important. One is hide and die syndrome. Hide and die syndrome. Second one, paradoxical undressing. So look at this now, this condition. So whenever question asked, try to memorize. Generalized hypothermia, 2 important syndromes. One is paradoxical undressing. So there will be undressing in hypothermia which is paradoxical. So consider a female suffering from generalized hypothermia naked. There can be suspicion of sexual assault. So try to memorize this. Here paradoxical undressing because of the involvement of hypothalamus. Sometimes because of generalized hypothermia there can be hide and die syndrome. Dead body can be found within the wardrobe or some closed spaces. That is again characterized by delusions, hallucinations from psychiatric illness. That is known as hide and die syndrome. The cause of death can be asphyxia or it can be generalized hypothermia. So 2 conditions all of you write in the chat box. Hypothermia leads to paradoxical undressing. Write this in chat box. Paradoxical undressing. Point number 1. Point number 2 is hide and die syndrome. Hide and die. Beta, not hide and seek. It is hide and die. Go and hide and die. That is basically hide and die syndrome because of the involvement of the higher centers like centers of frontal lobe, hypothalamus and all. So that leads to death. Okay, please write. Yes, very good. Anil Kiran, very good. Paradoxical undressing. बहुत बढ़िया. ठीक है. Now, in exam, you need to write this. Thermal injury is classified into due to exposure to cold. General effect already said. Local effect, frostbite, trench foot. Local effects of the burn injuries. So try to memorize this. Already I said, you can see here, heat stroke, heat cramp, and heat fatigue or heat exhaustion. So now question here is burn injury. So burn injury is the main question. 10 marks question. Scald is 5 marks question. So both are important. Okay? Yes, good, good. आगे देखते हैं now rule of 9. So next heading, rule of 9. Very, very important question. It's a dairy milk question. Rule of 9, it was first given by Dr. A.B. Wallace. In 1951, a Scottish surgeon who practiced at Bangor Hospital, Edinburgh. That's why it is also known as a Wallace of Rule of 9. It is very commonly used. What are the uses? What are the uses of this rule of 9? Anyone? Can you tell me? What are the uses of this rule of 9? One by one. One important use is to find out the surface area involved. To find out the surface area involved in postmortem examination, Shava Pariksha examination. So in case of burn injury, I just go to postmortem room, I'll just observe the dead body. Okay. By using rule of 9, I'm going to calculate, okay, this is the surface area involved. This is the cause of death. That is one importance. Then, this is also very important in prognosis. It has a prognostic value. It is used in prognosis. It is also very important basically for calculation of IV fluid administration. So three important functions or three important uses. One is to calculate surface area in postmortem. Second thing, to describe prognosis. Third thing, to explain amount of IV fluid required by using Parkland formula. Three uses are there. 1, 2, 3. 1, 2, 3. Yes, बहुत बढ़िया. Dhanush, excellent answer. You are great. Now look at this. So this is the simple rule of 9. Pudendal area 1%. Pudenda 1%. One upper limb is equal to 9%. One upper limb is equal to 9%. Front 4.5, back 4.5. This is the area of confusion. One upper limb is equal to 9%, front is 4.5, back is 4.5. One lower limb is equal to 18%. बेटा 18 है, 18 है, 18, 9 नहीं 18. फ्रंट 9 है, बैक 9 है. बहुत बढ़िया. आगे देखते हैं. Abdomen है 18%. Front and back 18. Thorax 18. क्या ना? Thorax. Head and neck area. Head and neck 9%. So this can be a 5 marks question. So 9 into 11, that is 99. Pudenda, that is basically 1%. So this is rule of 9. Rule of 9. Children is different. So children, we use LB formula, Broder formula. In scattered burn, we use Palmer rule. So one palm is equal to 1%. One patient palm is equal to 1% in Palmer's rule. LB formula in children. So that you can go through the notes after the class. Okay. Yes, guys, can you able to write answer for this? Can you able to write rule of 9 in exam? Rule of 9. Say yes or no. So Anil Prem Kolkar, हो गया? Shall we discuss some more important topic? Now after the class, go through this, classify skull fractures. There are different types of skull fracture, linear fracture and all. Okay, go through after the class. Linear fracture, depressed fracture, pond fracture, then perforating fracture. Okay, linear, depressed pond, hinge fracture, gutter fracture, pond, perforating, depressed. ठीक है? There are many types. Hinge, gutter, ring fracture. One more is ring fracture. ठीक है? Most common fracture is linear fracture. Linear fracture. You can write about the Poppe's rule in the exam. Poppe's rule. 3 marks question, usually 3 marks, fractures. चलो हो गया. Which is known as signature fracture? Anyone? Signature fracture. Which fracture is known as signature fracture? Your answer must be depressed fracture. The fracture commonly seen over the foramen magnum. Your answer must be ring fracture. The fracture caused by the firearm injury, gutter fracture. The commonly seen in children, pond fracture. Commonly seen in road traffic accident, linear fracture. Poppe's rule, 3 marks question. Okay. So where helmet ring fracture will become. Okay. Chalo, ho gaya. Now look at this. Yes. Now say example here, this picture. Now look at this now, skull. Skull. You need to answer now. What is this structure known as? This structure. Anyone? What is this structure? Anyone can identify? This is the common site of fracture. It's a common site of extradural hematoma. Bleeding from middle meningeal artery can lead to death, can lead to lucid interval and death. What is this structure known as? Anyone? Anyone, guys? I think now you need to answer. Try. Now I think is visible now. Yes, now you can make out clearly. Yeah, structure here. The 4 bones meet. What is this known as? So this structure is known as pterion. Very good. Pterion is the site. Yes, good. That's one thing. Now the second question. A fracture seen around the foramen magnum. So this is the foramen magnum. Okay. Fall from height. There is a fracture seen around the foramen magnum. What is that known as? What is that known as? Anyone? Anyone, guys? Try. It's basically ring fracture. Very good. Ring fracture. The most common site of fracture is temporal bone. The thickness of the temporal bone is 4 millimeter. 4 millimeter. The thickness of the occipital bone is 9 millimeter. It's very thick, but here it is very thin. The temporal bone is the common site of skull fracture. The common site is pterion. Common hemorrhage is extradural hemorrhage. Common vessel is middle meningeal artery. Common presentation is lucid interval. The treatment is immediate surgical intervention. Okay. Hope you are getting my point. Good. Okay. Chalo. Okay. The next question is transportation injuries. Can anyone try? What is transportation injuries? What are injuries? Transportation injuries. So the answer is primary impact injury, secondary impact injury, or secondary injuries. Transportation injuries. You can just go through after the class. 3 marks. Then electrocution. The very important finding is jaw burn, entry wound, can be 3 marks question. Cause of death is ventricular fibrillation. In high voltage burn, there are brownish nodules. That finding is known as crocodile skin burn. Important question. Lightning, it can be 5 marks question. In lightning, filigree burn, very commonly asked. Filigree burn, MCQ. Artificial bruise, 3 marks question. Aging of bruise, 3 marks question. Cutthroat injury, 10 marks question. Define injury, define assault, define hurt is a 3 marks question. Sometime question can be asked, what are differences between antemortem, postmortem, clot? 3 marks question. Sometime enzyme histochemistry of antemortem injuries can be asked. Okay. Medico-legal importance of burn injury. Medico-legal importance of electrocution. All these are commonly asked. Yes, good. Okay, next. Now image-based session. Are you there, guys? Image-based session. Shall we start image-based session, the last part of the discussion today? So we discussed so many things today in 1 hour. So I hope you are getting my points and it is beneficial. Forensic class, very interesting class, very interesting subject. Let's start now image-based questions, guys. Guys, how is the Josh? So your Josh should be high all the time in forensic class. Very high. Forensic class, FMT class, Josh should be very high. Okay? Yes, my dear student, how is the Josh? Let's start image-based questions. 1, 2, 3, 4, 5, 10 questions are there. You can try, you can interact with me. Okay. Hi, sir. Yes. Anil Khale is telling yes. Hi, sir. Waiting, sir. Dhanush is telling yes, sir. Rakesh telling hi, sir. Very good. Yes. Prem Kolkar. Fine. The first question. The first question is, okay. This is a case of road traffic accident. Okay. Died due to craniocerebral injury. So, craniocerebral injury. During Shava examination, so I am just opening now cranial cavity. So you can see the dura mater there. Hematoma is there above the dura mater. What is this known as? Hematoma above the dura mater. Anyone? Come on, guys. So this is dura. Very simple, guys. This is extradural hemorrhage. What is the bleeding artery? Middle meningeal artery. What is the classical presentation? Lucid interval. The period of consciousness between the two periods of unconsciousness. It resembles like drunkenness. Drunkenness. Treatment. The treatment is surgery, immediate surgery and removal of the clot. Okay, then question can be asked, what is the common fracture? Linear fracture. Linear fracture. What is the CT scan finding? Anyone? What is the CT scan finding in EDH? It is biconvex appearance. Biconvex appearance. Like a lemon shaped appearance. Now here MCQ asked, SDH. What is the presentation of SDH? CT scan finding is concavo-convex. Concavo-convex. What is the bleeding vessel? Bridging vein. What are the conditions associated? In boxers, shaken baby syndrome and repeated fall. Repeated fall, shaken baby syndrome in boxers, very common. Okay, and it is usually chronic in nature. It is a slow, chronic in nature. All are MCQ. Now here is one MCQ. Can anyone identify what is this structure here? This structure. Anyone? What is this anatomical structure on the other side? The normal side. Try. If you answer, you will get 3D chocolate from me. 3D chocolate from me. Come on, guys. I'm waiting. Waiting for your answer. Is dura mater? No, it's not. Is dura mater? Okay. What is this vessel? What is this vessel, guys? A कौन सा vessel है? Seen on the other side of the hematoma. So this is dura mater. Okay. Your answer is middle meningeal artery. ये क्या है बताओ? Middle meningeal artery है. MMA. On the other side. Good, good, good. Blood vessel है. बहुत बढ़िया. ठीक है. Middle meningeal artery. Yes, good answer. Good. हो गया. First question is done. याद रखना, extradural hemorrhage, lemon shape, subdural hematoma, concavo-convex, banana shape. Now, one very interesting question here in forensic medicine, related to forensic medicine. These three structures. Anyone tell me, when you know apple, anything related to apple in forensic medicine? So lemon already I said, that is EDH. Banana I said SDH. Apple related things in forensic medicine. Anyone? Can you try? See, when I think about apple, I remember cyanide poison. Cyanide. Apple seeds consist of traces of cyanide compound. You must have seen in web series and all. Okay, planned murder and all. Cyanide seeds, cyanide. And second thing, when I talk about apple, I remember thorn apple. Thorn apple. The thorn apple is datura. The drug of choice is physostigmine. Very interesting funda in forensic. Apple keeps the doctor away. Thorn apple keeps the physostigmine near. The drug of choice, thorn apple, datura poison, physostigmine, guys, physostigmine. So all of you write in the chat box. Thorn apple is equal to physostigmine. Physostigmine. Yes. Good answer. Good. बहुत बढ़िया. Yes, guys. Is it interesting, guys, if I teach you like this all the day, all the classes? So little comedy in between, variation of the voice, some songs in between. Is it okay? You will really like it? Or shall I teach you in a similar way I do teach? What is your opinion about this? Come on, guys. ठीक है, हो गया. हाँ, okay. First question is okay. First question EDH. After the class, go through this. Difference between EDH, SDH, SAH. EDH, I said. SDH, I said. SAH, remember, berry aneurysm. Worst headache of the life. Worst headache. सबसे worst headache in the life. That is basically SAH. Because of bleeding from berry aneurysm. That is involving circle of Willis, anticirculation. The investigation done is lumbar puncture that shows the blood. Berry aneurysm is the commonest cause for SAH, sudden death in young person. Okay. Yes, sir, Aldi. Must matching, must. Circle of Willis. हो गया. Next question. Next question, see. This is a case of murder. Now you are in the crime scene now. So there is a skull is there. The skull shows depressed. You know what is this? Skull shows fracture. And skull is depressed into the brain matter. By looking at this, I can tell the hammer is used in this case. The hammer was used in this case to kill the person. What is this fracture known as? That means heavy weapon having small striking surface. Heavy weapon having small striking surface. It must be hammer. It can be stone also. Okay. What is this fracture known as? Yes, very good. Many answered. This is depressed fracture. Also known as signature fracture. So here is the signature of the hammer, weapon. Signature. Very commonly asked. Medico-legal, it is very important fracture. Okay, hope you understood this. Okay. Yeah, there can be, yeah, yes, fine. Now look at this. Again, a case of head injury. Head injury. Endangering life. The person found dead. In Shava Pariksha examination inside the mortuary, the finding is there's a clearly visible hematoma around the eye. This is a bruise. It is known as migratory bruise. What is this known as? Migratory bruise. Also known as spectacle hematoma. Also known as raccoon eye. And again, the question can be asked about pathogenesis of this migratory bruise. What is the anatomical basis of black eye? Question can be asked in Viva. Anatomical basis of black eye. 3 marks question. 3 marks question. It based on the attachments of frontalis muscle, occipitofrontalis muscle. So it is firmly attached on the sides, but it is not very well attached in the front aspect of the skull. That question can be asked in Viva. Anatomical basis of black eye. Okay, so it is due to black eye. Intracranial fossa fracture. बहुत बढ़िया हो गया. Battle sign याद रखना पड़ेगा. 4 B's. Battle sign. Bruise is seen. Basilar skull fracture behind the ear. It was first discovered by William Battle, who was basically a surgeon. Now, very interesting question. There is a fracture of skull. What are these types of skull? What are these types of skull? Type 1, type 2 and type 3. Anyone identify this? Come on guys, identify now. So this is basically hinge fracture. Motor cyclist fracture. So type 1 means petrous bone, the petrous temporal bone, 2 sella turcica, 2 petrous bone. You can see here. This is type 1. The type 2, petrous bone, sella turcica, then to frontal bone on the opposite side. So this is the type 2. Type 3, frontal to frontal without involving sella turcica. The most common type is type 1. Type 1 hinge fracture, motor cyclist fracture, separation of anterior half from the posterior half in this case. So very serious injury, causes serious fracture, serious brain injury, craniocerebral injury and death. Good. बहुत बढ़िया हो गया. Next. Okay, can anyone tell me what is this, guys? What is this image? What is this image? गलती से आया होगा शायद, है ना? क्या लगता है आपको? Suddenly there is an image of the former president of US. What is this, yaar? I don't know. What is this? What is this image? Can you try? So this is basically related to firearm injury. It is basically artifact. What is this phenomenon known as? Very good, Dhanush. Dhanush beta, excellent answer. Kennedy phenomena. Kennedy phenomena. The history is the former president Kennedy, John F. Kennedy, he was shot dead by some culprits during election campaign. Soon after the incident, he was taken into nearby hospital and he was treated in some hospital. They conducted surgery. They haven't preserved his entry wound and exit wound. So entry wound, exit wound must be preserved. But in this case, the entry wound and exit wound was not preserved. This created a lot of confusion about the manner of death and the pathway of the bullet, a direction of the bullet. This phenomenon known as Kennedy's phenomena. So doctor intervention leading to confusion in identifying entry wound and exit wound is known as Kennedy phenomena. Okay? Entry Kennedy phenomena means confusion in entry and in exit. So normally in forensic medicine, in any case of firearm injury, we are going to preserve entry exit wound, at least photograph, video, sometimes skin also. But here what happened? Totally confusion. There's one more funda, magic bullet and all, that we will discuss in some other class. One more phenomena after the class, just try to memorize Royal-Seymour phenomena. Royal-Seymour phenomena. Royal-Seymour is a place in Andhra Pradesh. Okay. After the class, go through this, or you type the answer in the comment section. Royal-Seymour phenomenon. Yes, 5 questions. Very good. Okay, हो गया. चलो. हाँ, बहुत बढ़िया. Now identify this firearm. Flower नहीं, fire है मैं. Flower नहीं. What is this firearm? This firearm, guys, already we discussed. WAD 30 to 40. Okay, which causes large entry wound. Sometimes causes serious injury. What is this injury? Pushpa, guys, Pushpa Garu can answer this. The answer is, it is very simple. Shotgun. Shotgun means pellets. Pellets means only entry wound. Usually no exit wound. Range is 30-40 meter. Shotgun category 3 marks question we discussed already. ठीक है, राइफल नहीं है बेटा, ये क्या है? शॉटगन है. राइफल जैसा दिखता है बट ये शॉटगन है. ठीक है, याद रखना, शॉटगन. इट्स डबल बैरल शॉटगन 686. ठीक है, हो गया. एनीवे, चलो. Oh, what is this, guys? In forensic medicine, a case of hypothermia leading to damage to the higher center, false sense of perception of heat, false perception of the heat. What is this condition? Come on, guys. This is already we discussed. Paradoxical undressing. One more, hide and die syndrome. Good. Okay, now first answer by Anil Kerale and Nehas, Rajesh, Danush, Hi Shru. Yes, many answered. That's really nice. Oh, now one more important question in forensic. What is this attitude? Elbow flexed, wrist is flexed, claw hand like this, claw hand, the hip abducted, flexed, knee flexed, flexion. What is this known as? Neck is extended like this, neck extended. Come on, guys, come on, try. This is basically pugilistic attitude. It can be ante-mortem. It can be post-mortem. It can be both. So, not significant finding. Okay. It happens in burns. It occurs in case of burn injury. Heat stiffening when body exposed to more than 70 degrees Celsius. The cooked meat appearance. The coagulation of muscle proteins. Very famous case is Tandoor murder case. So, can go through after the class. Tandoor murder case. The first to answer by our friend Dhanush. Dhanush beta, excellent answer. Excellent. Next. Now very interesting question, guys. The interesting question is, here is a case of burn injury. Person found dead in unnatural condition. Now I am in the autopsy room. So during examination of the face, one who died due to dry burn injury, due to extensive injury, sudden death, either due to carbon monoxide poison or neurogenic shock or carbon monoxide, whatever it is. Now here, look at the eye. In the eye, you can see the mixed appearance. Some area hypopigmented, some area hyperpigmented. Hyperpigmented because of the deposition of the soot particles. What is this condition known as? What is this condition known as? What is the importance of that? Come on, guys. Come on, guys. It's not crocodile skin, beta. ये crocodile skin नहीं है. Crocodile skin brownish nodules होता है इसमें. इसमें क्या है? Hyperpigmented है, hyperpigmented area है. ये देखो. Dance देखो. देखो इधर. Closed eye है. You can see the lines are there. Can you make out the hyperpigmented lines, white lines? And you can see the dark line. So lighter area, darker area, light and dark, light and dark. What is your inference as a forensic expert? बहुत बढ़िया. बताओ जल्दी बताओ guys. Time नहीं है. Time very important. Okay, filigree नहीं बेटा, ये filigree bone भी नहीं है. Filigree नहीं है, नहीं. Filigree bone in case of lightning, I said. This is a case of dry burn. It is not filigree. No, I'm totally confused. I don't know. What is this? Anyone? You don't know. I don't know. What is this? Filigree is a thunder. Thunder नहीं, वो भी नहीं है. नहीं बेटा, नहीं. You can take your AI help also. You can identify. Anyone? Guys, filigree is on the chest. Oh, good. Filigree on the chest. This is answer is crow feet sign. Crow feet sign. It's a case of flame burn injury, antemortem burn. Antemortem burn. So because of the severe burn injury, the person closed his eye very tightly. So during the incident, there is a deposition of the soot particles over the eye. But after death, because of relaxation, because of the second relaxation or primary relaxation, you can see here pale areas. The pale areas are areas of contraction during the incident. Darker area are the areas of exposed skin. So it's a antemortem burn injury. Crow feet sign. चलो बहुत बढ़िया, बहुत बढ़िया. ठीक है. Now आगे देखते हैं. Now I am in the crime scene now. You are in the शव परीक्षा room. Bhoot Bungalow series. Now look at this. There are some important findings are there. What is this finding? What is this finding? This finding. One by one. I'm going to give you 20-second time. You need to answer this. So one thing for sure, there are blisters are there. Blisters means blister is there. Point number one, it's a blister. Is it antemortem blister, postmortem blister? If albumin is there, line of redness is there, history of dye burn is there, burn injury is there, scald is there, then it is antemortem. Probably albumin is present. Albumin is a plasma protein. Blister. This is tattoo. The tattoo shows religion. And this is line of redness. Line of redness. So by looking at the eye, I can say that probably this person exposed to heat. So there are blisters are there. And line of redness is there. The question can be asked, what is HIBRA classification, Wilson classification, Dupuytren classification? After the class, go through Dupuytren. So please write in the chat box, guys. Homework, Dupuytren. What is Dupuytren? Wilson, HIBRA classification. Write this in chat box, everyone. Dupuytren, Wilson and HIBRA. Okay, ho gaya. And the last question of the day. This is very interesting question. Very, very interesting question. Look at this. So we are in the Shaw Pariksha room now. There is one injury is there. Over the hand, there is one injury is there. You can see the crater formation, black discharge, gray discharge. You can see here. Okay, this is the one image. Second image, same person. What you can see here, over the sole, there are multiple punched out lesions are there. So punched out lesions. My question is, what is your finding? Punched out lesions. Punched out multiple lesions. This is point number one. The point number two. Point number one is, what we can see here in this image, clearly visible crater formation. Crater formation. That means here is a shallow ulcer. Shallow ulcer with a black discharge surrounded by gray discharge. So this seems to be jowl burn, endogenous burn. Now, anyone, tell me now. Now you need to solve this. So this is basically a case of electrocution. What is the cause of death? Ventricular fibrillation. Manner of death commonly accidental. So this is as per 194 PNSS, Police Inquest. So as a forensic expert, the postmortem examination, punched out lesions are there, multiple lesions are there over the sole. So the electric current is passing from upper limb, then to the heart, then to the lower limb. The pathway is upper limb, then heart, then the lower limb. So this is the electrical circuit in the body, leading to ventricular fibrillation, leading to death of the person. I hope you are getting my point. Okay? Okay, now understood, guys? Yes. So this completes today's session. One session about the injuries. Especially we discussed in detail about grievous hurt. 8 clauses are there. So pakka question in exam and overview of important questions as well. Any doubt you can ask me, guys. If you have any doubt, you can ask me. Yes, hope you understood. Okay, very informative. Thank you, Akash KS. Keep rocking, keep answering. Nehas is telling sir, thank you. Yes, very interesting. Rajesh is telling sir, very much interesting. बहुत बढ़िया. Left hand to right feet. Okay, bad route. चलिए ठीक है. समृद्ध है. Okay. Sir, love from UAE. Thank you sir. Okay. Oh, बहुत बढ़िया यार. Oh, Darshan Patil is telling, sir, you are best teacher. Yaar, thank you, yaar. Thank you so much. At least in forensic medicine. Yeah. Rakesh Malana was telling, thank you, sir. That's great. Any doubt? Any doubt in today's session? Okay. Okay. Anil Kerale, I think you just go through today's first slide. So, okay. Chalo. We discussed already. Chalo, this is about the today's session. Let's come up with some more interesting Booth Bungalow series, Filmia Funda series in next class. Okay, next class we'll discuss some more interesting cases in forensic medicine, some more interesting crime stories. You know, forensic means crime stories only. So forensic medicine, basically application of medical knowledge in administration of justice, like example suicide, accident, murder and all. To find out the cause of death, to find out the manner of death, to identify the dead body, to identify the age of the person. So that is the duty of forensic expert. So this completes today's session. Thank you all. Bye bye.